Yeah, yeah, yeah. I'm still here after all these years, after all these tears I shed. I'm still here and I'm walking this earth like I should be. There was days that I didn't know if I would be. Yeah, yeah. Now I stand tall with my feet in the ground and my head in the clouds. 'Cause I'm still here like I should be. Yeah, yeah, like I knew that I could be. Here we go, here we go. I'm still here. I'm here.
Hey everyone, a few things before we jump into our last interview from the Sensational Survivor Series of summer, which it's technically after Labor Day, so I'm going to say it's after summer. But being that I needed to press pause for a couple of weeks, I wanted to bring you this interview with Sheppard. We have known each other for quite a while now. We've both been living for many years with metastatic breast cancer. Unfortunately, the audio is not the best on this, but I just felt like you still needed to have it. As we head into fall, I hope to continue spotlighting survivors at least monthly. And of course, Larry will be back and some other guests as well. So thank you for sticking with us, and please enjoy Terlisa Sheppard.
Welcome back. I'm the best, I think, for the end of this. I'm so excited today to have Terlisa with me. Would you introduce yourself to the few people who don't know who you are?
Hi, everyone. I am Terlisa Sheppard. I am a 26-year breast cancer survivor. Those 26 years, I've been surviving metastatic breast cancer for 23 years now.
We met, I believe, at the die-in a number of years ago in Washington, D.C.
Yes, I remember that, and I still have a picture.
Yeah, I had pictures with Ellen DeGeneres. That's right. Can you tell us a little bit what was happening in your life before cancer? And was it a surprise? And what was
Mine before cancer is crazy that to even think about it because I was 31 at the time and now 58. That's been almost half my life.
Yeah.
At this point is my life with cancer. But before cancer, I thought I was the most healthiest person around. I had never been sick, had only been in the hospital to deliver my first child. And at the time of my diagnosis, I was at 8.5 months pregnant, carrying on with life, thought everything was hunky dory and moving about life. At my career as an accountant, at the Department of Defense, I was married, and like I said, was a young mother of one daughter, about to have my second daughter.
And how did you find the cancer or what happened?
Because I was under constant care with my OBGYN, I had noticed some growth in my left arm, more so like the armpit area. And I mentioned it to him, and I mentioned it several times. And he told me, Lisa, I think it's clogged ducts. And we're just waiting to see, nothing to worry about. I went on waiting, and that wasn't the outcome. It got down to the point where I like, you got to go further with this. It's more to this than just clogged ducts because it was growing right along with the pregnancy.
I had that as well, growth with the pregnancy, but it did not equate for me. So
Unfortunately, it didn't equate with me. I had no idea what the outcome would be, but I knew it wasn't something normal during the pregnancy. But no, not in my wildest imagination that I thought it was that.
So what kind of testing did they do?
I went for a biopsy. My OBGYN at the time, he was like, if you insist, we'll do a mammogram now and we'll do one after the pregnancy just to, I guess, show me and make sure everything was going right. And for the mammogram. And immediately after that, the physician was like, we need to do a biopsy. They knew from the mammogram that something wasn't right. And I went through the stages. And as I was going on, I had left work that evening and even told my coworkers, I was like, I'll be back. I'm just going for a mammogram. I'm coming back to work. I didn't make it back to work that day. After several tests, week biopsy, it was cancer.
And you still hadn't had your daughter at this point?
No, they did put all the gear on me and he did all the tests. And I was alone doing all this because, again, in my mind,
You thought it was no big thing.
it was no big thing. I was going back. Now I was given a cancer diagnosis and had to drive myself home across town. Complete shock.
Absolutely. And then what was the plan? Deliver your daughter?
The plan was to
Can't
deliver
remember.
my daughter like almost immediately.
Okay.
But then after everybody, the medical team started together and everything, it's like, let's do things, all of that. And it was like 2 days later, I was delivering my daughter.
The overwhelm, the thought of all of that brings me. How did you deal with it? How did your husband deal with it?
It was wild,
Yeah.
to say the least. I had so many thoughts and emotions running through my head. 31 years old, again, these things coming at me. And just to even think, I got to deliver a daughter, a baby, and I have cancer. I have breast cancer, and I have my job.
And you
my
have another
career.
child.
Exactly, who had just turned 2 years old, like weeks later earlier.
How do you focus on anything at that point?
I had to, even though the whole shock of things, I had focusing on my baby and my family. And I took myself out of the equation for the time being. It was like, I can't quit. I can't give up right now. Or even if I had that thought of doing that, it was full steam ahead. I got to do this. I was given the information that you got to deliver your daughter as soon as possible to try to stop the growth as much as possible because sure, the estrogen was feeding the tumor like crazy. So those were my options.
Yeah. So how quick did you begin treatment?
The goal was to deliver my daughter immediately and start treatments immediately. But my blood count went plummeting very low. So I could do treatments right away it was only like 2 to 3 weeks later that I did start treatments and started 4 cycles of adriamycin and after that I was cycles of Taxol and just started going through the motion of it all.
Did you have help at home?
Yes, I had help. My husband at the time and my family. I'm from a large family. They came in droves. My sister at the time, my youngest sister lived on the same block as So her husband, family, or sis, she actually was pregnant at the time along with me and had 3-year-old. So I had help. And still, after all of these
Yeah.
years, my family, friends, neighbors have been amazing.
That's great. I have to ask you because my daughter was 14 months old when I was diagnosed. She's a very independent child. And sometimes I wonder how much the cancer plays in that because I, of course, was focused on her, but also I had a lot going on. And she just has always been really good at doing her own thing. Do you find that with your kids, or especially with your older one?
The thing with me, because of their young age, and of course the youngest had born,
Right.
they didn't think else
Yeah.
but me being a cancer. And even to this day, they're 26 and 28. It's been my life, all of their lives. So they went through the
Do they just
motions.
roll with it?
They just roll with it. And didn't have all of the things that we have now as far as counseling with all small
Yeah.
kids and
Yeah.
retreats and all of that that kids can go through. So they had to get it from environment that I had. The church was amazing. Stepped in, like I said, friends, neighbors, everybody. Those my counselors, if you will.
Yeah. So you said you were initially diagnosed stage 2. Is that what you said?
3
3.
I was originally diagnosed stage 3.
Okay. And how did you find out about progression?
I started to have back pain. I was back at work after my earliest day diagnosis. Yeah. Through the chemotherapy, radiation, surgery, and back at work, going about life, even not that I did think that I couldn't be diagnosed with a static, but I just didn't think about it. It wasn't on my mind. So I was having some back pains and say something, it's not right here. And again, I had never really been sick anything at this point now, since the cancer diagnosis. But I went to my doctor.
Yeah.
Unfortunately, I was diagnosed with a slight bladder infection and was given medication. And after taking all of the medication, that bladder infection didn't go away. It wasn't a slight bladder infection. After my medical oncologist got wind of it, and I went in to do T scans and PET scan, everything like that, it had metastasized to bones, lungs, and liver. Just
Wow.
2 years later since my last treatments.
Wow. How do you deal with that?
It was crazy to deal with. First of all, because this was in 2001. Again, not as many things were in place as research
Yeah.
and knowledge. So I was after giving my diagnosis, it had metastasized to my bones, lungs, and liver. My oncologist at that time, she immediately said, Terlisa, this is not good. I want you to go home, quit work, and get your life in order. I was 36 years old, 34 at the time of first metastatic diagnosis. And with 2 small kids, ages 3 and 5, even imagine.
I unfortunately can, because it did happen to me also in the same way. Get your affairs in order. And I was like, I'm not even sure what affairs I have. Like my student loan debt. What do you want
about this?
I know. It's just not a phase. Those phases don't go together, right?
At all. Not at all. And I've read and talked to some other young mothers and who have gone through some of the same things that we have gone through. And it is painful to even hear it now, Heather.
Yeah,
It just brings up old feelings and
I agree.
the compassion that I have for that person. Because I've
Yeah,
lived through it, I've walked through it. My babies had to go through it. And
I
even just
agree.
talking about it now, I get choked up just thinking, oh,
The initial part of that stays with me always, and I think it's always where my heart really is. With those moms with young babies or women didn't even get the chance to have babies. It's just, it comes so early sometimes. It really thwarts our ability to live life.
absolutely. I said, it hit the nerve.
It
And
does.
I know how badly I wanted kids and even wanted more. The thing they told me, don't even think about having kids.
Yeah.
That was the end of that, which I had later decided that I was going to adopt a child. But then I kept getting progression at the time, and I was like, I think it's fair to bring another child into this at this moment.
Get it. So, what did you do for treatment with Met?
I had, oh my goodness, because they had given up on me, it was like throw a book at her, see what this stick, see what this help. So I had weekly Taxol treatments. I remember going down on a Monday having treatments. My white blood cells would go so low. I had to get the shots, injections, like 3 days in a row, Tuesday, Wednesday, Thursday. I had Fridays off for doctor's appointments for, and mind you, I could barely even walk during these times. I had my sister at the time taking me to the cancer center to my appointments. No, whomever that was around that could get me down
Mm-hmm.
for my appointment. And it was like going through the motion. I was because I was so sick. And I remember just being sick and tired of being sick and tired. It was very harsh. And
Yeah.
still being a young mother at the time.
Yeah. What carried you through?
Oh my goodness. My faith is one. The love and support of my family, friends, church, taking care of my daughters. My daughters would wait at the front door. This church member would pick them up for church. So they're like things like that didn't stop. It wasn't the normal that kids were going through, but to them, again, that's all they knew.
Yeah.
And then they had a positive support system around them.
Yeah, they were having fun.
They were having fun. It was somebody different showing up.
That's exactly. Had the same thing. My daughter was just telling her fiance the other day. Yeah, these couple women from church would come and I would go cook with them. And yes, you
Oh my
did.
goodness. They would pick them up and they would, Mom, can we call Sister so and so? Can we do this? And I was like, oh my goodness, worry them to death. But they were happy to do it. They were happy.
Yeah. Yeah. And you know, too, how it makes you feel to be able to help somebody else out.
Oh my goodness. Love it. As a matter of fact, I will be going to volunteer at the end of the week to
Yeah.
give back to breast cancer survivors.
Yeah. It feels good.
Yes.
Yeah. How have you dealt with uncertainty, progression, all of those kind of things? Because I know it's been a bumpy road sometimes.
Oh my goodness. It's, you have, I was going to say you have to, but no, everybody is different. In my mind, I have to keep spirit of, I'm not giving up. So this is what I'm going to do. I know that I've had many uncertainties with metastatic diagnosis, one progression after the other. The cancer pretty much has metastasized all over my body, bones, liver, spine, abdomen, and brain. And the whole time, I'm raising daughters. I divorced in 2005, right in my diagnosis, and it I was hit with one thing after the other. Had to have a right hip replacement. I ended up getting a blood clot in my lung. It's been one thing after the other, and literally, I've been on some type of treatment since my metastatic diagnosis 23 years ago. I just try to put the most positive attitude, and I've gotten Terlisa attitude, positive attitude doesn't cure cancer. No, I didn't say that. For me,
Right.
dealing with all that I've had going on, I've had to put myself in a place where I can deal with this as best as I could and as
Yeah.
best as I can at this current moment. Because I'm on treatments for life until there's a cure. And I can't just sit back and not do the best that I can do. And to
Yeah.
get whatever knowledge that's out there and not only helping me, but helping others.
Yeah. Do you get anxiety?
Goodness, yes. And some might not even think about that after all of these years. Yes, I still get anxiety. Yeah, like I said, I have a follow-up appointment tomorrow with my surgeon to have the port removed and couldn't remove all of it because it's been there for 23 years. What is the next step? What am I going to have to go through next? Literally had some drawbacks after that port had broken inside and literally couldn't lift my arm, my right arm that much on the side where the port was located until it was removed. So yes, I go in and especially the brain MRI. It's like, oh, I hope it's nothing that's lingering because as any metastatic breast cancer thriver, survivor could tell, there's times that you just never know.
Yeah.
Something that's simple pain that you might think is very simple might not be.
Yeah. It's so hard to find a balance between that. When you were talking about earlier having pain and it thinking it was a bladder infection, that makes complete sense. After living with cancer for so long, you go to cancer right away, but try not.
Exactly. Exactly. I even jokingly said, Turley said, can't blame everything on cancer.
Yeah.
I've tried.
I feel the same way. It also, though, it's crazy how many things do tie in. I've had a lot of sinus stuff this summer, but also I don't have much of the bottom sinus because osteonecrosis of the jaw. Thank you, biphosphonate.
Yeah.
So it does.
Oh my goodness. Yes. I went to the pharmacy today and granted, I am many years down the road, which I didn't think I would be here this day. And I've gotten older. I'm picking up all of these medications from the pharmacy and say, never thought that I would be doing all of this at this stage in my life. Shirley, so you're getting older, been living with a metastatic diagnosis for 23 years. Yeah. The medication and go.
Yeah. Right. You do a good job of balancing let's live life as well as deal with disease.
I have to. You understand, being in
I do.
this life for so long and our families, our loved ones, it's just not about me. And that's the attitude that I have. It's not just about me. I owe whatever I can do to try to push the needle forward. Those that didn't have the chance to, for those
Yes.
young thrivers, survivors that
Yeah.
weren't able to make it
Yeah.
this far. So it sometimes I get tired in some of the things that I'm doing, and I don't even think about it. I think about the lives of others, and that just gives me additional energy, strength to move forward.
What advice would you give to someone who's just been diagnosed metastatic disease?
My advice that, which I live by, is don't let the diagnosis get in your head so much. I've had to learn that, especially having the different bumps along the way, the hip replacement. Like, where did this come from? Too young. And then I put around, and after taking everything out, it was like Terlisa, it wasn't cancer, it was necrosis, years of treatments and all of
Yeah.
that. And it's thank you. And just, and knowing that I'm on some type of treatments for the rest of my life, I have to go to that center every 3 weeks, going to various doctor's appointments. I literally have a physician for every bone in my body at this point. With all of that going on, I have to constantly remind myself, you're still here and you're still here for a reason. Don't let all of the noise get in your head to make depression, put you in a mindset that you want to get quit.
Yeah.
So don't let the diagnosis get in your head. Focus on living in the moment, one moment at a time.
I love it. Are you hopeful about treatments that are coming and what you see potentially on the horizon?
Yes, I am hopeful. I have to be, because I remember when, I remember 23 years earlier when I was diagnosed metastatic. Thankfully, others are not given that same prognosis that I was given. My prognosis immediately, we don't have things to treat you.
Yeah.
You're a lost cause.
Yeah.
Yes, I've seen things happen along the way.
Have
And
you accessed drugs that you didn't know about in the beginning?
oh, of course,
Yeah.
and to see some of my friends going through some trying times right now with additional progressions and stuff, I have to have hope. And
Yeah.
it hurts me to go on social media to talk to someone, and I got additional progression. It's putting myself in that mindset. And I even tell my daughters, my family, it hurts so bad to see others in this journey going through all the things that they're going through. So I have to have hope, that things will get better for us all.
Yeah. I agree. And I think everybody to have be able to think, I just need to be here until thing comes, right?
Yes,
The next
yes,
drug, the next treatment, hopefully sometime a cure.
yes. Have been giving up on that
Yeah.
for this moment, a treatment
Yeah.
that would help so many that are having such a hard time going through this.
Yeah. A tolerable treatment, something that people can, because like you were talking about being on the Taxol early on, like when all you're doing is laying on the couch in between treatments, it's hard to call that really living with, I don't know, joy.
Oh my goodness, were you inside of my house? Oh,
No, I've
you
done
did.
that. I did a double stem cell transplant, so I know what it means.
Oh my goodness. Day in and out. What I would do, I would get up every morning and dressed and everything, get my daughters off to school for and put some makeup on. I had to put my game face on just to sit on the couch in the dining room.
Yeah.
My mom had moved in with me for a little while at the time, and it was like holding a hand out for breakfast, lunch, and dinner for
Yeah.
some medication. I was too weak to even go to the driveway, but I would make it from my bedroom to the dining
Oh,
room, sit on the couch, look out the door, And that was pretty much my life going through that early stage of my metastatic diagnosis. I was so very weak. I had lost so much weight.
Yeah.
Mouth sores, everything that
You
you can think of, I went through
Yeah.
it. And sometimes I'm sure there are people that might look at us on the outside and see or not even understand what we could have possibly gone through at that
Yeah.
time. But again, treatment options and stuff weren't what they are now. And maybe things were still being tweaked at that time.
Yeah.
The dosage to give someone.
Yeah.
We may have been guinea pigs, who knows?
I definitely signed a paper. And
Yeah.
actually, I'm on Foslodex. I started in 2004 at 250 milligrams. After they did it for a while, they went to 500. And now I'm back to 250 because we're just like making our own rules at this point.
Oh, yeah.
And I feel comfortable with that. I was like, it used to be that. I was stable on that. So,
Absolutely. I had to change my dosage as well. And others need to understand that there are different those
Yeah.
initiatives that you can try and talk. Be willing to talk everything with your oncologist, your medical team. And my oncologist, I love her to death. She knows that I got all of these notes in phone when I'm thinking of stuff. And if it's too long before my next appointment, then I'm putting it in the portal
Yeah.
to ask the question, whatever.
I
The way
agree.
that I deal with this, and right now, that has worked wonders for me.
Yeah. So important to have a team that you believe in and that believes in you.
Absolutely. When you can go to your medical oncologist and she comes in the room and greets you with a hug, and
Absolutely.
before she leaves, she gives you another hug. I love it. In
Yeah.
spite of all of a terminal cancer diagnosis, but
To have the relationship is awesome.
absolutely.
Is there one thing that you would want people to know about life?
Oh my goodness. It you have heard and probably will hear, it's relentless. It really is. My my career was taken because of my cancer diagnosis. I was an accountant, worked in the Department of Defense, loved my job, but went through immediate retirement at age 34.
Yeah.
Different things in life. Like I said, my sister used to live on the same as friends around the same age. I sat and watched and family members or whomever around my same age go on with life while my life was at a standstill. So again, protect your mental health. Give yourself some self-care. You need it. You will need it.
Yes.
It's okay to take care of you. Step back from it all for a moment. And I'm constantly going to the beach or to a local park, a Disney World.
I see this.
But being around others, and I tell my daughters, I was like, I'm going out to Disney and some strangers, and I really do. And before it's all over with, I met one and I come back rejuvenated, ready to move forward in whatever I'm doing. Like, trying to live life fullest with what I have at this moment. Like I said, giving up is not an option. And I've reached a point where I never even envisioned that I would make seeing my babies grow up. I remember I want to see them get old enough to remember that I was their mother. That was the hope and concerns that I had at that moment.
Yeah.
And then I found myself, I would say, Terlisa, while you're being so busy dying, preparing to die, you need to be busy preparing to live. I flipped that, and I have been living in every moment. I don't get so caught up in so far out there and ahead of myself. I
Yeah.
concentrate on this moment at this time.
You're doing it right, and you're such a role model for other people. And thank you so much for being a part.
Thank you. Thank you. And it all gives me strength when I'm going to various conferences and I'm reaching out for others, and I need this. I
Yeah,
really would. It, it,
I
it,
love it.
it helps us all.
It does.
We are a community.
That's right. We rise by lifting others.
Absolutely.
Thanks so much for watching and being a part of our community. It means the world to us. Our goal is always to help as many people as possible live well with cancer. You can help us by subscribing to our channel and sharing episodes when you hear of others that could benefit from it. We really appreciate your time spent with us and your commitment to offering hope and inspiration to others.